Hello. The importance of empathy and improved communication in patient care is crucial and well established in the context of clinical care. The outcomes of these actions are known to lead to greater patient satisfaction and understanding of their disease treatment, better compliance, low medical care expenditure, lower malpractice litigation rates, lower medical error rates, and improve healthcare providers' well-being. In this webinar, we present some practical ways to enhance empathy and communication skills in clinical setting. According to Roja, empathy is a predominantly cognitive rather than emotional attribute that involves an understanding rather than feeling of experience, concerns, and perspectives of the patient, combined with the capacity to communicate this understanding. In his article, he describes some practical approaches to enhance empathy. First, we'll talk about the improving interpersonal skills, which is a prerequisite to demonstrate empathic behavior. Suckman, Markakis, Beckman, and Frankel in 1997 came up with an interpersonal model of empathy communication in the medical interview, which focused on the development of three basic communication skills: recognition of patients' negative emotions, concerns, and inner experience, exploration of these emotions, concerns, and experience, and acknowledging them to generate a feeling in the patient of being understood. Its goal is the formation of an empathic engagement in the healthcare provider-patient relationship and the provider's recognition of an empathic opportunity when the patient directly or implicitly expresses emotions or concerns. The focus of the training is to capture the windows of opportunities the providers obtain to express empathy and to avoid pitfalls in missing or terminating them. Methods to maintain the dynamics is by engaging in positive enhancers towards the patient, such as nodding the head to imply understanding and use of simple statements to reinforce the support. Attention to nonverbal communication is also imperative in establishing an empathic relationship. These include changing tone of voice, eye contact, gaze or aversion of gaze, silence, laughter, teary eyes, facial expressions, hand and body movements, trembling, touch, physical distance, leaning forward or backward, sides, or other signs of distress or uncomfortableness. Providers' gestures and attitudes such as folding of arms or moderately open arms, mirroring patients' postures, tempo of speech, and language pattern influence the empathic relationships. Second is the audio or videotaping of encounters with patients, and posteriorly reviewing these recordings, which may add valuable learning experience for enhancing empathic relationship and identifying missed opportunities to engage on it. A study performed by Morse, Edwardson, and Gordon in 2009 revealed that only 10% of physicians responded to empathic opportunities in their communication with lung cancer patients. Third one, it's exposure to role models. Some investigators point out that faculty can serve as role models or mentors to improve students' capacity for empathy, and that is the most effective approach to teach empathy. The fourth is role-playing, or also known as aging games. It is suggested that role-playing results in the development of awareness and increased understanding of elderly patients by walking in a patient's shoes. Varkey, Chutka, and Lesnick in 2006 used a variation of the aging game by submitting 84 medical students in two first-year classes to wear heavy rubber gloves to simulate decreased manual dexterity and goggles with films over the lenses to simulate cataract. Afterwards, they reported statistically significant increase in empathy. Another important topic worth of training is diversity in the healthcare setting. Diversity is clearly noticeable in hospitals and medical centers across the United States. It occurs among healthcare providers, staff, and patient population. So understanding this diversity and aiming to improve communication skills in these settings is highly important to break down barriers to reach out and educate patients. In 2013, the United States Department of Health and Human Services Office of Minority Health established a culturally and linguistically appropriate service or class in order to address the issue. They set as communication training in the workplace. The training should be encompassing and go beyond the traditional accent modification, segmental approach of vowel and consonant pronunciation, and include pronunciation, stress, and intonation, including in working the knowledge of figurative language and idiomatic speech, auditory discrimination, active listening skills, general vocabulary outside of one's specialized field, sensitivity to nonverbal communications, and an understanding of numerous cultural considerations affecting one's daily interactions. A 2002 study by the Joint Commission on Accreditation of Healthcare Organizations documented that communication was the root cause for more than 65% of hospital death and injuries and 55% of medication errors. As stated by Pittman, Folsom, and Bass in 2010, the number of foreign-educated nurses have grown from 6% in 2000 to almost 17% in 2007. And according to the Bureau of Census 2010, 18% of the population over 5 years of age, or 47 million people, speaks a language other than English in their home. And that by 2050, the Hispanic population will grow from 13% in 2000 to 39% in 2020. Another way to act on diversity is through effective communication between healthcare providers, patients, and family members, which is critical to assure positive outcomes and avoid medical miscommunication that may contribute to errors, injury, and death. The training to acquire an effective communication is usually implemented by speech-language pathologists to the diverse healthcare providers. At the end, we have the Jefferson Scale of Physician Empathy Questionnaire, which is adapted to the healthcare providers. It's a training questionnaire in a 5-choice Likert system, ranging from 0 to 5, 0 being strongly disagree and 5 being strongly agree. Now that we've covered information about how to deal with the problem, Garland Dees Hazer is going to discuss practical training recommendations and evaluation of nurses as virtual audience. Thank you.